To quote the amazing Dr. Nadine Burke-Harris, this country has a national health crisis on our hands, and that is the overwhelming number of kids enduring toxic stress and the symptoms of trauma and complex PTSD symptoms. Toxic stress can be defined as a response that occurs when a child experiences strong, frequent, and/or prolonged adversity, such as physical or emotional abuse, chronic neglect, caregiver substance abuse, mental illness, exposure to violence, and/or the accumulated burdens of family economic hardship without adequate adult support. Little bodies and brains that are consistently exposed to these types of things have monumentally higher rates of physical health, emotional, and behavioral issues. These issues don't cease to exist as these children reach adulthood. Quite the opposite is true, actually. Studies have shown that neuroplasticity of the brain is greatest between the ages of 0 to 5. So what does this mean? Basically, what this is saying is that our brain is most primed for absorption of experiences and memories at this time of our life. So if I'm frequently witnessing my caregivers being violent with one another for the first few years of my life, or I myself am being abused or neglected for those first few years, even if I don't remember these events as an adult, these events have already imprinted on every part of my physical and mental being. This concept of toxic stress directly correlates with the idea of ACEs, or adverse childhood experiences, which I'm sure a lot of us are familiar with. So for every ACE that you experience as a child, you increase your risk of experiencing things like asthma, cancer, diabetes, and many other chronic health issues. And the chances that you engage in risky behaviors, become an alcoholic, or develop a drug addiction as an adult increase exponentially with every ACE you're exposed to. So what do we do about this? How do we as social workers and change makers make a dent in this ever-growing crisis? Early identification and intervention is the key. Just as trauma and toxic stress changes our brains and bodies, resiliency also changes our brains and bodies. The earlier we can identify the presence of toxic stress in a baby or child's life and then intervene with resources and help for that child and that family, the better chance that child has of living a healthy and resilient life. And what better way to reach the largest number of children and families with most regularity than at those yearly child exams, using an already developed and effective trauma screening and intervention program called Healthy Steps. Social workers trained in the Healthy Steps method could work right alongside the doctors and nurses in the actual pediatric clinics. When considering the 12 grand challenges of social work, this issue resonates most with challenge number 1, ensure healthy development for all youth. There is enormous inequity in this country when it comes to wealth and income and access to adequate healthcare and resources. Being able to effectively reach families of all ethnicities, income levels, geographic locations through something like annual health exams that most children and families access fairly frequently can help close that gap and therefore ensure healthier mental and physical development for kids. As I mentioned earlier, Healthy Steps is an evidence-based, team-based pediatric primary care model that promotes the health and well-being and school readiness of babies and toddlers. There's an emphasis on families that are living in low-income neighborhoods who may not always have the greatest access to basic resources. Healthy Steps partners with the pediatric primary care team to provide tailored support for common and complex concerns that doctors and nurses don't always have adequate time to address, such as behavior, sleep, feeding, attachment, parental depression, social determinants of health, and adapting to new life with a baby or toddler. In addition, the Healthy Steps program also utilizes several risk screening models to identify children and families most at risk for child abuse, neglect, and other forms of toxic stress. They are able to address their needs before emerging concerns escalate. Minimum screening can include questionnaires to assess maternal depression, food insecurity, housing instability, utility needs, transportation needs, domestic violence, community violence, and substance misuse. Healthy Steps professionals are able to meet with the families and guide them during their well child visits, as well as in between those visits. So it's a wonderful opportunity to meet families where they're at. After a 15-site randomized controlled trial and several subsequent site-level research studies, results have demonstrated that Healthy Steps parents were 22% less likely to use harsh forms of punishment, things like threatening, spanking, hitting, yelling. Longitudinal analysis indicated that participation was associated with greater security and attachment to parents. Healthy Steps parents were better able to notice behavioral cues and provide age-appropriate nurturing and discipline. Children were more likely to receive their well child visits on time, as well as their vaccinations on time. Families were 4 times more likely to receive information on community resources. Children were 23% less likely to visit the ER for injuries in a 1-year period. Currently, Healthy Steps programs are in 20 states and over 160 pediatric practices, but I'd like to see Healthy Steps in all 50 states. Utilizing psychosocial development theory, we can see how both internal and external factors influence childhood development. Erickson, the founder of the PST theory, claims that people advance through stages of development based on how they adjust to social crises throughout their lives. These social crises instruct how individuals react to the surrounding world. We can also use these stages of development as a roadmap to healthy maturation. We can look at the stages and see where a child may have developmental stunts caused by a trauma and better know how to intervene to increase resilience. When looking at this issue from an advanced generalist perspective, we can see it from a micro, meso, and macro point of view. Micro would be that one-on-one interaction, that client to social work relationship, such as getting the Healthy Steps worker to meet with the child and family during that annual well child visit. This builds the trust and relationship between them and gets them to engage with the program long-term. Meso would be looking at the issue from an agency perspective, such as getting Healthy Steps programs into as many pediatric practices and as many towns and cities as possible. Macro, here we look at this issue and how it affects policy and practice in the field. We can see how introducing a trauma screening intervention model can have long-term macro level results on childhood development and resiliency. We as social workers could write policies and grant proposals to make sure that even the most rural areas have access to Healthy Steps programs within their pediatric practices. I focused on competency 3 and competency 8 when compiling info to support bringing these screening programs into mainstream healthcare. Competency 3, advanced human rights and social, economic, and environmental justice. There's so many oppressive barriers that people in poverty face on a daily basis, and so many basic rights and resources that not everyone has access to. Through resource education and early intervention of trauma and developmental concerns, we can help to eliminate many of those harmful barriers for kids and families. Another issue is the insane inequity in this country. By intervening and offering these screening services during something like a well child check, something that most every child will have at some point in their early childhood, we can ensure equitable distribution of social goods and human rights. Competency 8, intervene with individuals, families, groups, and communities. We as social workers are intervening by early screening of children and families so we know what interventions would be helpful or needed to increase resiliency and a healthy development. We're also intervening with groups and communities by interprofessional collaboration between the pediatric health unit and social workers acting as Healthy Steps staff. So it's a collaboration between 2 helping professions for the overall health and well-being of the client. The social work values I chose to focus on for this particular topic were social justice and competence. I feel like the most effective way to bring about social justice within certain communities is to advocate for your clients. Use skills you have as a social worker to bring about awareness or a voice to an issue or a group of people. When we advocate for those who are unable or unsure of how to advocate for themselves, we start to introduce justice and equity into the issue. And without continuously working to expand our knowledge of the latest and most effective family interventions, effective screening tools, or resources available to communities we are working in, we cannot be competent social workers in any issue we are taking on. When we lose our ability or drive to remain competent in this work, we become a liability and more harmful than helpful to our clients. So considering all this evidence-based research on the effectiveness and long-term advantages of early screening and intervention of toxic stress and trauma, what is my recommendation? We should introduce the Healthy Steps program as part of the primary care assessments for all children, starting with that first postnatal checkup, and then yearly as part of the well child checkups. As mentioned earlier, Healthy Steps is already established in 20 states. I would like to see this program offered in all 50. Moving forward with this would require strong collaboration between social workers trained in the Healthy Steps curriculum and screening tools and pediatric medical staff around the US. Typically, the program's cost per child receiving the most comprehensive services ranges between $450 and $900 annually. The primary cost of launching and sustaining Healthy Steps are Healthy Steps specialist salaries and employee benefits, which are ongoing costs. and the initial Healthy Steps site training, which is a one-time fee. Other ongoing costs may include dedicated office space for Healthy Steps specialists, information technology, and other equipment and materials. Interested pediatric and family practices should complete an interest form on the Healthy Steps website. A member of the Healthy Steps team will reach out and schedule a call to answer any additional questions and discuss the next steps. Once sites have secured funding and have signed a contract, Healthy Steps will schedule the training, Healthy Steps Institute, for the practice, and the practice will begin implementation, planning, and participate in pre and post implementation technical assistance. So what does this mean for the future? We should be taking proactive rather than reactive approaches to addressing childhood trauma and the long-term effects of toxic childhood stress. We should be intervening at the most crucial stages of development rather than dealing with it later in life, such as expensive medical intervention for health issues experienced as an adult due to chronic trauma they went through as a child, extensive and complicated and expensive behavioral interventions, such as juvenile offender programs and incarceration as an adult, the overrun and underfunded foster care programs when children have to be removed from the home and placed in state custody. And Healthy Steps can help to address all these issues and save money on these programs in the long run, while simultaneously increasing the mental, physical health of kids and promoting healing and resiliency.